Welcome. Blood cancer, also known as leukemia, is one of the most serious and life-threatening diseases affecting the human body. It begins in the bone marrow, the soft, spongy tissue inside our bones where blood cells are made. In leukemia, the bone marrow produces abnormal white blood cells that don't function properly, crowding out healthy cells and weakening the immune system. There are mainly four types of leukemia. 1. Acute lymphoblastic leukemia mostly affects children. 2. Acute myeloid leukemia AML, common in adults. 3. Chronic lymphocytic leukemia CLL, develops slowly over time. 4. Chronic myeloid leukemia CML progresses gradually but can become severe if untreated. Let's understand how leukemia develops. Normally, our body makes controlled numbers of blood cells, red cells, white cells, and platelets. But in leukemia, a mutation occurs in the DNA of blood-forming cells. These mutated cells multiply uncontrollably, flooding the bloodstream and preventing normal cells from doing their job like carrying oxygen, fighting infections, and clotting blood. Now let's talk about the common symptoms of leukemia. People may experience persistent fatigue, frequent infections, unexplained weight loss, fever, night sweats, pale skin, easy bruising or bleeding, and bone or joint pain. In many cases, swollen lymph nodes or an enlarged spleen can also appear. What causes leukemia? The exact cause is still unknown, but several risk factors have been identified. These include genetic mutations, exposure to high radiation, certain chemicals like benzene, smoking, family history of blood cancer, and previous cancer treatments such as chemotherapy or radiation therapy. Diagnosis of leukemia involves blood tests, bone marrow biopsy, and genetic testing to identify the exact type and stage of the disease. Now, let's move to the treatment options. Treatment depends on the type and stage of leukemia, but the most common methods include chemotherapy, the main treatment that kills or stops the growth of cancer cells. Radiation therapy uses high-energy rays to destroy abnormal cells. Targeted therapy focuses on specific molecules involved in cancer growth. Immunotherapy boosts the body's immune system to fight cancer cells. Bone marrow or stem cell transplant replaces damaged bone marrow with healthy cells. With medical advancements, the survival rate for many leukemia patients has improved significantly. Early diagnosis and proper treatment play a major role in recovery. Let's remember, leukemia is not always preventable, but maintaining a healthy lifestyle, avoiding exposure to harmful chemicals, and having regular medical checkups can help reduce the risk. In summary, leukemia is a type of blood cancer that begins in the bone marrow and affects the production of healthy blood cells. Recognizing symptoms early and getting proper medical care can save lives. Subscribe my YouTube channel.